When you think of older people, you might think it's common for older people to experience incontinence and an inability to control their bladder. But in the case of men, did anyone tell you there is one anatomic reason behind frequent urination? It's important to talk to your doctor if you're a man experiencing bladder control or voiding issues and frequent urination, especially at night. One of the things that affects a man's bladder function is not even their bladder per southeast, but rather their prostate. Remember how we said anatomical reason? If you know your anatomy, you can observe how the prostate is sitting below the bladder, and it also surrounds the urethra, a tube that goes out of the bladder. After puberty, the prostate experiences a second round of growth, and it gets bigger with age. If it grows too big, it could squeeze the urethra, making the pathway narrow, and also push against the bladder. This is what men aren't told enough about their bodies. This growth of the prostate causes two problems: urges and inability to void properly. Imagine how frustrating it must be to want to urinate, but then when you get to the urinal, you struggle to get the urine out. Prostate enlargement is also known as benign prostatic hyperplasia (BPH). If men don't find out about this early enough, combined with the fact that men don't go to the doctor as often as they should, they may get a late diagnosis of BPH and find little option to fix their issues except for medication carrying side effects such as sexual dysfunction and surgery carrying risks. We should tell men about their bodies and show them how common it is for men to experience BPH in older age. Statistically, almost 50% of men in the US, between 45 to 50, have BPH, and that rises to almost 90% for men in their 80s and 90s. As healthcare technology advances and life expectancy is expected to increase, men who are living longer could very well face issues with their prostate. Let's spread the knowledge and find a solution for mild BPH in the forms of lifestyle changes and natural, clinically proven plant-based treatments.